Hello everyone, this is Obsessive Compulsive Disorders for ASN 215 Week 5 discussion. Obsessive compulsive disorder is characterized by unreasonable thoughts and fears that are called obsessions that persist and recur so that they cannot be dismissed from the mind. Compulsions are ritualistic behaviors that an individual feels driven to perform in an attempt to reduce anxiety. The obsessions and compulsions cause distress in the patient, they are time-consuming, and interfere with the patient's life. Obsessive compulsive disorder is thought to be a dysregulation of serotonin levels, and in some patients there's a hyperactivity in the prefrontal cortex and a dysfunction in the basal ganglia and the cingulum. It usually begins in the late teens or early 20s, and there is a higher incidence among single people as opposed to married or otherwise. Some nursing interventions for obsessive compulsive disorder patients. Make sure you allow time for rituals initially and then gradually limit how much time you allow for the rituals. You want to give positive feedback for independent behavior and assist the patient with determining the causes of anxiety. You don't want to judge or disapprove of the rituals or attempt to force the patient to not complete a ritual. Some expected outcomes of obsessive compulsive disorder is that the patient will verbalize that the anxiety they feel is controlled. The patient will identify precipitants and patterns for anxiety and demonstrate techniques to control anxiety. And physical signs of anxiety, such as tremors or changes in vital signs, will be absent. These are just some of them, but there are many more you could use. Some treatment modalities you might see in a patient with obsessive compulsive disorder are medications, typically antidepressants such as SSRIs and TCAs, cognitive behavior therapy, which can help the patient control the symptoms, exposure and response therapy, which helps expose the patient to the feared object to kind of develop a tolerance to it, and then self-care such as eating nutritious food, getting lots of rest, exercising regularly to manage stress. This has been Obsessive Compulsive Disorder. Thank you.